Are you or someone you know a caregiver for an individual with Lewy body dementia?
Well, you're in luck.
To start out, let's begin by talking about what Lewy body dementia is. Lewy body dementia is a progressive form of dementia that leads to decline in thinking, reasoning, and independent functioning. It affects about 1.4 million individuals and their families in the U.S. and closely resembles Alzheimer's and Parkinson's.
This happens when abnormal microscopic deposits called Lewy body proteins develop in the brain over time and cause damage to the brain cells.
People with Lewy body dementia begin having a decline in thinking ability that may look somewhat like Alzheimer's disease. But Lewy body dementia progresses differently than Alzheimer's.
Over time, they also develop movement and other distinctive symptoms that suggest dementia with Lewy bodies. Symptoms that distinguish this form of dementia from others may include visual hallucinations early in the course of dementia, fluctuations in cognitive ability, attention, and alertness, slowness of movement, difficulty walking, or rigidity, REM sleep behavior disorder in which people physically act out their dreams by yelling and falling out of their bed, and more trouble with complex mental activities such as multitasking, problem solving, and analytical thinking than with memory.
Unfortunately, there are no treatments that can slow or stop the brain cell damage caused by dementia with Lewy bodies.
Throughout the process of Lewy body dementia, it is important to remember that you and your loved one are not alone. Many medical professionals can help. Remember to contact your primary care physician for diagnosis and direction for where to go next. Other health professionals may help to improve quality of life, such as occupational therapists, physical therapists, speech therapists, psychologists, ophthalmologists, if your loved one is experiencing changes in vision, neurologists, home health aides, nurses, sleep specialists, mental health counselors, and even art and music therapists.
Many individuals who suffer from Lewy body dementia are primarily cared for by spouses, children, and other loved ones. According to a survey by the Lewy Body Dementia Association, 64% of respondents indicated that they were the person who had primary responsibility for care of the person with Lewy body dementia. 46% of the respondents lived in the same household as the person with Lewy body dementia, and 62% indicated that they saw a person with Lewy body dementia on a daily basis.
As a caregiver, it is normal to have concerns about the future. Concerns include increased risk for poor sleep, depression, or illness as a result of your responsibilities as a primary caregiver. Watch for signs of physical or emotional fatigue, such as irritability, withdrawal from friends and family, and changes in appetite or weight. It is important to remember to take care of yourself by maintaining a healthy diet and getting adequate amounts of sleep. Others may not understand the burden that you feel as a caregiver or how the progression of your loved one's disease is impacting you. It may become stressful, and it is important to have a strong support system.
Some important tasks that the caregiver may need to undertake include educating others about the needs of the individual with Lewy body dementia. This includes hospital staff, family members, and friends. Preparation for emergencies. This includes having a list of medications, copies of health insurance cards, and advanced care directives. It is also important to be able to adjust your expectations. People with Lewy body dementia have fluctuations in mood throughout the day. Assisting a loved one when standing up from a chair or getting out of bed to ensure that they do not lose their balance. Understanding that your loved one may need more assistance some days than others. And lastly, self-care. It is extremely important to take care of yourself in order to best take care of your loved one.
As a caregiver, it is also important to have positive communication with your loved one. Improving communication skills will make caregiving less stressful and will improve the quality of your relationship. Be sure to do the following when conversing with your loved one. Set a positive mood for interaction. Limit distractions and noise in the room. State your message clearly and use simple sentences. Refrain from raising your voice, and if your loved one does not understand you the first time, use the same wording to repeat your message. Ask simple, answerable questions. Listen with your eyes, ears, and heart. Be patient in waiting for your loved one's reply and listen for the meaning that underlie the words. If your loved one becomes upset or agitated, try changing the subject or environment. Respond with affection and reassurance, and be sure to maintain your sense of humor whenever possible.
There are many resources available for both Alzheimer's disease and Lewy body dementia. These can both be helpful for caregivers. For Lewy body dementia specifically, opportunities to connect with individuals, caregivers, and families who are seeking support during challenging times include Lewy Body Dementia Caregiver Link and the National Office for Lewy Body Dementia. The Alzheimer's Association also has a 24/7 hotline that can be used, as well as their national office and online resources. The links to Lewy Body Association as well as the Alzheimer's Association can be found in the link below the video.
Other resources for caregivers of individuals with dementia, including Lewy body, are Support Services and Resources Elder Care Locator, and Federal Government National Institute on Aging, Alzheimer's Disease Education and Referral, or AIDER Center.
Family Caregiver Alliance is another community resource that provides information and referral, education, and other services to caregivers of people with chronic disabling health conditions, including dementias.
Caregiver respite options will give you time to focus on your health and well-being. Adult day programs can also provide the opportunity for your loved one to increase social participation in your community. Some of these local Buffalo resources include People Inc. Seniors Unlimited Adult Day Program, which meets the needs of many elders who have a variety of conditions. It is a flexible program that can accommodate needs for earlier drop-off and later pickup. Erie County Senior Services provides activities tailored to meet individual needs. And A Gathering Place Social Adult Day Program has organized daily activities in a community-based setting, transportation, meals, and professional supervision.
It is often important for many older adults to stay in their homes rather than experiencing the stress of moving to a new home, nursing home, or an assisted living community. Helping loved ones and yourself to age in your own home will reduce stress levels and caregiver burden. One way to make caregiving easier on both the caregiver and the recipient of care within the home is to adjust the environment. This means making the home safer and more accessible as a person ages and possibly declines in physical and/or mental functioning. An occupational therapist can work with you and your family to ensure that recommendations to increase independence and safety are specific to your wants and needs, skills, environment, and budget.
Some ways to make the environment better for older adults with Lewy body dementia include remove unnecessary throw rugs, use grip tape on stairs, eliminate clutter, install grab bars, reduce electrical cords, and explore community-based groups such as Rebuilding Together, whose volunteers help repair and modify homes for those who can't afford to do so.
Remember, as a caregiver, you are not alone. It is important to utilize resources that are available to you. Thank you for watching, and be sure to check the links below in the description box for additional resources.